Morning, I'm Karis Jackson from Active Rider, and today I'm going to help you hopefully reduce your knee pain. I'm going to give you my 5 top tips to help knee pain. First one up, what kind of trainers are you wearing? If you're wearing Converse, nice brightly coloured pair that you thought looked quite nice, or a cheap pair from the sports shop, this could be your issue. By not having a correctly fitting trainer, you're not supporting your foot well. If your feet aren't supported well, it can cause issues around your knee stability as well as your pelvis, which can reduce or cause knee pain. Everyone's feet are slightly different, whether we've got flat foot, high arch, wide feet, etc. So to make sure that a trainer fits you correctly, you're best off getting proper advice. If you Google now, trainer shops in your area, you should hopefully find one where they offer a gait analysis and you can go in, do some walking, jogging or a treadmill, or they might look at you off the treadmill and assess what foot structure you have and give you some options of what trainers might work. This should hopefully help reduce your knee pain. Top tip number 2. What are your quads like and compared to your hamstrings? As riders, we commonly use our quadriceps a lot, which is your front thigh muscle, because of the rising trot, because of the cross-country position, because of the nature of our sport. However, if we don't use our hamstrings enough, it means that our quads are a lot stronger than our hamstrings and can place a lot of pressure on the knee. By strengthening up your hamstrings, you're reducing this pressure and balancing out the quadriceps to hamstring ratio. Top tip number 3. What's your bottom like? If you have the world's smallest, flattest bottom, that means you don't use it. By getting a bigger, stronger bottom, you actually use your glutes or your bottom muscles. Your glutes are an incredibly powerful muscle and great for helping stabilise the hip. If you don't use your glutes, it means you use your quads a lot, and again, by having really strong quads and weak glutes, you can help pull your knee out of alignment, which can cause your knee pain. So let's get lying on the floor and doing your clams and all your other glute exercises that you've been shown previously. Top tip number 4. You have something called your IT band, which is a band of fascia that runs from the side of your knee all the way up into your hip joint. This is very common to get quite tight, especially in people that use their quadriceps a lot. It's notoriously hard to stretch out, and the best way to loosen it up is to get a foam roller or a tennis ball and either roll it up and down your leg with your tennis ball or roll on it with your foam roller from below the knee right up into the glute. I'm going to show you how to do this now. Top tip number 5, very, very simple, seek advice. If you're not sure what's going on with your knee pain, rather than guessing and trying out lots of different exercises, you're best off seeking expert advice from a physio. They really know what they're talking about. Pick a highly reputable sports physiotherapist nearby, and if need be, if you've got health insurance or your NHS, you can actually get a referral from your GP. Good luck. Any other queries, let me know. Otherwise, you're speaking to Karis Jackson from Active Rider.